Chapter 6 deals with the origins, categories, advantages, limitations, and differences in designs of quantitative research. We will discuss the advantages of using different types of designs, limitations to those designs, threats to validity, and challenges posed to the researcher. Clinically based research should be focused on groups of patients. The roots of quantitative research are in positivism, which, according to Alison Terry, the writer of our clinical research book, positivism is maintaining that there is an objective reality that can be quantified by measuring or observing in some way. We are looking for patterns which exist due to how the world operates. Observational studies are one of two types of quantitative research. They are further divided into cross-sectional surveys, longitudinal studies, case control studies, and experimental studies. Experimental studies encompass clinical and randomized controlled trials with pre- and post-test designs. When the researcher uses quantitative design, it allows for correlational and causal relationships between variables. This means the researcher can analyze statistics and test the hypothesis using logical outcomes. The quantitative design also allows the researcher to use an objective approach to observing and reporting behaviors of the research subjects. The instrument can be selected to gather data without emotional involvement and increases the likelihood of focusing on the statistical significance of the hypothesis. Furthermore, the researcher can identify potential risks to the study early on and avoid complications as the study progresses. However, quantitative research may lack subjective data related to human experiences, such as emotions, habits, perceptions, and personal variables. This does not allow for perceptions and experiences by the participants that could yield different results for the final project outcome. Another issue in the clinical nature of quantitative research. Participants may have negative perceptions about not only the researcher, but the study itself due to this limitation. To be considered an experimental study, the participants must randomly be assigned to treatment, control, and comparison groups, with the control or comparison receiving no or standard treatment within the scope of the study. A randomized controlled trial is the strongest design for healthcare professionals because it allows for specific healthcare interventions to be performed and monitored in a longitudinal nature. This is often the best choice for DNP researchers to use. The trial involves randomly selected subjects in the experimental group, or the group that receives the experimental intervention, and a control group that receives no intervention beyond current standards of care. Selection bias is a threat to the research design's internal validity, which is the ability to infer that the independent variables actually cause the change seen to the dependent variable. Randomization protects the study from selection bias. Bias can also be reduced through blinding, which happens when neither the subject or the researcher is aware of the group that the subject was assigned to. For the researcher to perform an effective randomized controlled trial, he or she must make sure to randomize using sufficient numbers for both the control and the experimental group. These projects may be lengthy and thus costly, and participants must be willing to continue to be followed beyond treatment. As a student, be careful to consider how much time you have to produce this type of study and result. Pre- and post-test designs are the object or process being studied before the intervention occurs, and then again after the intervention. A weakness of this type of design is that it's difficult to assign causality to the intervention due to no randomization or control group. This could potentially allow for other factors to affect the outcome of the study. Sometimes this is the only way to assess impact of an intervention, however, and it should not be discounted completely. Strengthening the pre-post design by assigning a control group or by using multiple time points may help. In the book example, they assessed response before and after new respiratory ventilators were in place. If the patient improved despite no other intervention, the researcher could reasonably conclude that the ventilator made the difference. The Solomon-4 group design is a variation of this type of design and examines both the main effects of testing and the interaction of the tests of an intervention. This type of design uses two groups who use the intervention and two who do not. Only one group has a pre-test, but all four receive the post-test. A positive side to this type of design is the ability to recognize pre-test sensitization. One weakness is that it requires a large number of participants for the study and can make it hard for the researcher to introduce the intervention in exactly the same time for all the groups.
Subgroups, as mentioned, are those that can be used as a type of experimental design. For example, non-randomized control groups may be used for research with the understanding of the limitations of this type of design. These are used when randomization is not possible, ethical, or when evidence is not enough to justify the difficulty and the expense of randomization of a trial. This is also referred to as a quasi-experimental or non-equivalent control group, and these are good options for the DNP researcher with less time, manpower, or finances to randomize a control trial. To be considered a non-experimental design, there needs to be systematic collection of data with no use of control groups or randomization and no use of statistical controls. A cross-sectional study is performed at a specific point in time. This type of study has no follow-up with the participants of the research and is often performed using internet questionnaires. This means that researchers can often get large numbers of participants quickly, but that respondents may not answer questions completely or may leave out questions that take too much time or effort to answer. Questions must be very clear, and responses must be collected from a large sample to make the cross-sectional study valuable to the researcher. Longitudinal studies focus on causative agents as researchers follow groups of participants over time. This type of study uses cohorts, or a group of subjects followed by the researcher. This is a good design if the researcher needs to follow up on a clinical situation that may have caused harm. For example, patients cannot be told not to take medications in a clinical trial if there's known benefit to the drug. But researchers can study the effects of non-compliance over time if subjects naturally choose not to take the drugs according to their physician's instructions. This type of study is extremely costly, however, since researchers often follow subjects for years at a time. The study may also suffer from attrition or the loss of research participants during the course of the study. This could potentially cause the sample size to become too small for comparison. Case-controlled studies are used when the researcher studies a particular trait or disease. Here the control group is made up of people who do not have the disease or trait, but match the other demographic traits of those in the case that do. This allows for researchers to determine the possible factors that may have caused the condition and compare the exposure of each factor as a potential causative agent. This can often be quickly implemented, but drawbacks include the difficulty in obtaining control subjects similar to the case participants, establishing that exposure to the causative factors actually happened before the outcome. A research design is considered quasi-experimental if participants are not randomly assigned to groups, although there may still be a control or a comparison group. Statistical controls are used instead of random assignment of subjects. This design is especially useful if a randomized study is not feasible or ethical and cannot be conducted in real situations. This may also be a good choice when attrition in the treatment program has already occurred. One group post-test only design is similar to a case study but does not use a pretest baseline or comparison group. This makes it difficult to conclude the effects of treatment and would not be a good choice for the research design for a DNP student. The non-equivalent control group design functions the same as a regular experiment without randomization of subjects. Thus, it can be difficult for researchers to avoid threats of internal validity. Threats may include selection, which occurs in the way the research subjects were chosen, or when the researcher subjects do not make a representative sample. The subjects may also have a personal history which may interfere or affect the dependent variable, which is unknown or undiscovered by the researcher. Aging or maturation, which may result in changes that can confound results. Even something as simple as taking a pretest can confound the post-test score because it may improve the subject's post-test results. Thus, the outcome is not due to the intended intervention, but to learning or the natural bias that occurs after knowing or understanding what is being tested. Instrumentation threats are changes in the way the variables are measured, such as changes in technique by the researcher. And finally, mortality or the loss of subjects results in attrition. Limiting these threats can be very time-consuming and/or costly. The researcher, or in this case the student, must carefully consider if they have the resources to decrease threats to internal validity. In time series studies, researchers collect data over an extended period of time, during which they expose participants to an experimental treatment. The advantage to this type of design is that it's likely researchers will be able to correlate changes with the introduction of treatment. There are several variations to this design. Simple, interrupted time series designs use multiple pre- and post-tests within one group. Researchers look for trends to determine if change is due to the intervention. Because there is no control group, there is no way for researchers to prevent historical, selection bias, or instrumentation bias threats to validity. Interrupted time series with a non-equivalent no-treatment comparison group allows researchers to test two groups with pre- and post-test design using an untreated control group. Threats to validity can more easily be disproved by using the control group for comparison. However, it is difficult for the researcher to ensure both groups are equal in all measurable aspects. Interrupted time series with multiple replications occurs when the researcher initiates treatment and then removes treatment at multiple intervals. This is even more effective when done so randomly, so the researcher can prove the intervention caused any perceived effect. This would only be effective if the treatment rapidly resolves prior to the initiation of the next interval. It is not effective if the substance or treatment may have additive effects. Finally, interrupted time series with switching replications uses two groups where the treatment or control is rotated between them. Thus, the treatment group becomes the control group for the next series in the study. As with the previous model, this is only effective if the drug or intervention used does not provide cumulative results. External validity is the generalizability of the results obtained. The study will have less external validity if it is too specific to a certain population, and the results cannot be applied to anyone else. As with internal validity, it is important to minimize the threats as much as possible. These threats may include pre-test sensitization, which occurs when post-test scores are not representative of the untested population of participants because the pre-test sensitized the participants to the information. Interaction of selection and treatment is the idea that bias in the selection process occurred and may cause the results to not be typical of a larger population. Reactive effects occur when the conditions of the study are not representative of real-world situations. Multiple treatment interference occurs when it's impossible to determine which of the multiple treatments influence the results. Irrelevant responsiveness is when the measures include irrelevant components indicating change has happened when it has in fact not. And irrelevant replicability is the idea that researchers may fail to use treatments or parts of treatments that are actually responsible for creating the change each time the subjects are exposed to it. This chapter focused on quantitative design, but it's important for the DNP student to investigate qualitative designs as well. This will be reviewed in Chapter 7.